want to thank you for joining us. My name is Jessica Zavala, and it's my pleasure to welcome you on behalf of the Ohio Program for Campus Safety and Mental Health again to today's virtual roundtable discussion, Stronger Together, Mental Health and Suicide Prevention on Ohio Campuses. Before I dive into, or before we do, I dive into today's discussion, I do have a few brief announcements to make. We encourage you to join us at the upcoming Campus Safety and Mental Health 7th Biennial Conference. That's on May 15th in Dublin, Ohio. You can come together with field experts and specialists to discuss mental health, campus safety, and suicide prevention on college campuses. Registration is open now at the link which Chris has provided in the chat. You're also invited to join NeoMed's Department of Psychiatry Coordinate Center of Excellence and PEGS Foundation for the 2025 Drs. Fred and Penny Freeze Lecture as we welcome Brandon Staglin from One Mind. As co-founder and chief advocacy and engagement officer, Brandon channels his deep experience in leadership, advocacy, and personal schizophrenia recovery to drive mental health innovation and community engagement to heal lives. So that lecture will be held on May 6th from 12 to 1 p.m., both in person and live stream. We welcome you to join us. You can find additional details regarding upcoming events on our website and social media channels. And of course, feel free to like, subscribe, and share on our channels. We are excited to announce our final webinar, which will feature members of the Collegiate Mental Health Advisory of Ohio to discuss the student perspective on mental health on campus. More details are to come soon for that. And then also, as we approach the close of the 2024-25 webinar series, please keep an eye out for a chance to share your input on topics to be highlighted next academic year and provide some feedback in our annual survey. Finally, this webinar will be recorded and the video will be made available for viewing on our YouTube channel. Today's virtual roundtable discussion, as you can see, we can see all of you, is in a different format. So we encourage you to post questions or comments that you may have in the Q&A or chat function during today's presentation, and we certainly hope that you will engage in the discussion. And so without further ado, I know you all are waiting to hear from our esteemed panelists for brief introductions. And so starting with Allison, before we dive into discussion questions today, would you mind introducing yourself and then passing along to our other panelists?
Sure, happy to kick us off. Good afternoon, everyone. My name is Allison Doring. Please feel free to also call me Allie. I currently serve as our Senior Director for the Student Advocacy and Support Office, known as Zip Assist at the University of Akron. I also have a dual role with the Office of Advancement and serve as the Development Officer on behalf of the Division of Student Affairs. This topic is of deep interest. I'm in the data collection process for my dissertation, which is examining the role that student affairs professionals play in disclosures of mental health and hardship from today's college students. So happy to be a part of today's conversation. Dave, please feel free to go next.
I was muted. There's the technology stuff again. Hi, everyone. Thank you, Allie. My name is David Nardecki. I'm a clinical counselor and assistant professor at Tri-C's Western Campus in Parma. I am a co-founder of the Help Us Here mobile app and website, as well as serving in different capacities on our campuses and colleges' behavioral intervention teams. And I focus predominantly in suicide prevention as well as crisis intervention. And we also have mental health coordinator roles at each campus. And at our campus, I am one of those identified individuals. So I'm really happy to be here and looking forward to interacting with everyone on the call today. And with that, I'm going to go ahead and turn it over to Carrie. Thanks.
Thanks, Dave. My name is Carrie Kane, and I serve as the Assistant Dean of Student Affairs at the Cuyahoga Community College Eastern Campus. So I do work with Dave at the college. I have served as assistant dean for a few years, and then prior to that, I was the manager of counseling for the West Shore campus of Tri-C. I've spent my career in education working in K through 12, 4-year and community colleges, and much of that has been looking at holistic student support and also working with behavioral intervention teams as well. So I'm looking forward to being here today, sharing my experiences, hoping that maybe they offer some insight and also learning from my colleagues as well. So thank you.
Again, we are very excited to welcome our panelists today. And I will kick it off with the initial question. And if you've joined us since our introduction remarks, I just want to remind everyone again that this is a virtual roundtable discussion. And feel free to place any comments or questions you may have in the chat. And if there's something too that you would like to share, you can feel free to use the hand raise icon, and we would certainly love to incorporate your feedback and or comments or questions within the discussion. And so I will kick it off with the first question, and this is actually pulling research from the 2023-24 Healthy Minds study, and many of you might be familiar already with that. And so that study shows that across the country, about 38% of students experience moderate or severe depressive symptoms. About 34% experience moderate or severe anxiety. And of course, 26% of students engaged in non-suicidal self-injury within the past year. And so I'm putting this out to all of our panelists. In your experience, what are the most pressing mental health challenges facing college students in Ohio today? So we want to look at this in our state, and how have these evolved in recent years?
Go ahead and get us started. I think contextually, there's so many factors I think that go into some of our mental health challenges and concerns that we see. I think contextually, things such as, and certainly coming from my domain and student support, housing insecurity, food insecurity, affordable childcare, social support networks in particular, snowball almost in creating these challenges for so many of our students. And so I think in the work that we do, we see a lot of disclosures from students related to anxiety and depression, as you have highlighted, thoughts of self-harm as well. And I think in there is also burnout. We continue to hear from students that they're just tired. And I'm sure we'll get to this later, but I think a lot of us as practitioners can say we're there too, right? But we certainly hear a lot about burnout. I think in terms of how those have evolved, I have sat in this seat for about 7 years, but have been in higher ed for about 15. And so certainly can attest that in the last 15 years, disclosures from students continue to increase. I think that is, as a society, continuing to do a lot of work destigmatizing, seeking mental health support, and talking about our emotions and our concerns and how we're feeling. And so I think it's sort of this, a little bit of a shift that we know that, yes, we are hearing more from students, but at the same time, I think we're hearing more of those disclosures because of all of the work that's being done to try to destigmatize help-seeking behavior and reaching out when you know that things are starting to bubble up or bubble over.
So to echo what Ali was sharing, one of the things that we have noticed in addition to what Ali has shared, obviously at Tri-C, it's a non-residential institution. So clearly we realize that many of our students are impacted by activities or events that transpire on the outside, as we like to say. And clearly the things that happen on the inside will impact, obviously, everything else. So the example that I like to use with my students is I ask them to envision themselves sitting on one end of a teeter-totter and then adding each individual responsibility, to the other end of that. And then, kind of evaluating and assessing where that equitability or that equal leverage is. And we find sometimes that many of our students are kind of dangling at the top end of that teeter totter with their feet hanging down and with no stable foundation for which to be able to plant their feet. And like Ali has shared, we have students that are indeed homeless. We also have students that are struggling with food insecurity as well. When we add all of this to the data that nearly 1/4 of all individuals between the ages of 18 and 25 are exposed to their first mental illness or bout with um, uh, a mental illness related malady such as depression or anxiety, it just adds to the fold. And what we have tried to do at Tri-C is normalize the discussion. We have attempted to recognize that everyone, irrespective of who we are or what our background is, struggles with some limitation or challenge of some type. So, one of the things that we have set out to do is clearly to normalize the discussion. And part of that includes the wording and the phraseology that we use with students, and to make accessibility of extreme importance. And on that note, Carrie will be able to follow up with some of those accessibility things that we do offer.
So, yeah, just adding to the conversation, I think we know that, these challenges don't exist in isolation. They tend to overlap, they tend to build upon each other. And so you have students who are facing this emotional fatigue and burnout, and then it starts to present itself in perhaps substance abuse and other unhealthy coping mechanisms, which only exasperates all of the other challenges that they're facing. So um, I think we're going to continue to see that as the world is changing so quickly. Even in the last couple months, we have students who are challenged by their sense of belonging and their sense of identity. And how is that going to continue to present itself on campus and through some of their maybe already pre-existing mental health challenges that they're facing, or new challenges for other students. And we do have, resources, and trying to get students to understand that they don't have to go through this alone. Most disability services, which is one of the areas that I do oversee at the college, they're increasing their accommodations for students who have mental health related needs. And so being able to access those types of resources once they have their diagnosis, and working with those resources would really be a great referral for many of the students that we're trying to assist.
Thank you so much, everyone, and apologies for my technical difficulties during the introduction there. I'm glad to be back with you all. And Dave and Carrie really kind of started us off with this next question of what is your campus doing to help change the conversation about mental health and suicide prevention? I know that language was mentioned. I'm curious if there might be anything to expand on with that or other ideas.
I would say just making sure that there's space for the conversation to be had. Right. I think certainly ensuring that we have marketing pieces and outreach pieces available is one thing, and that language is so important. Dave, thanks for bringing that to the conversation. But I think also just making sure that we are finding different ways to bring folks together, to share national data like we started off today, but then to drill it down into what are we seeing on our campuses, and being transparent as a community to say, this is the national statistics, and this is how it looks within our team, from our care team or our BIT team analysis, or maybe your early alert and intervention team, and really allowing that to help guide the conversation. I think providing transparency is important in that conversation. And I think more than anything, it's also allowing folks to understand the role that they play in the way in which we are working to educate our students, educate ourselves and our communities about what the mental health needs are of our students, and all of us, our employees as well. I think not discrediting the mental health of our employees is a really important part of that conversation. So having human resources around the table is just as important as having your folks from student affairs or your provost representing your academic side.
I think you hit the nail right on the head there, Ellie. Just, bringing in the broader stakeholder group to be able to have those conversations. I'm going to defer to Dave to talk about the student-specific prevention that we're doing on campus, but looking at just who's at the table, who needs to know this information, campus leadership, ensuring that there's financial resources available for operationalization of some of these resources that we do need to be able to get in front of students. And I don't want to forget that faculty have weight, like their voice has weight with our students. So we have to normalize and we have to engage the faculty in these conversations because they're seeing students on the day-to-day basis, every day for some classes. And so what can we do to support the faculty in the classroom to be able to help normalize that, whether it's some type of syllabi language or even just offering them some templated like language resources so they can start conversations and knowing who to call in when they need it.
So that's an interesting segue because how Help Us Here started was actually in 2013. What a core group of four of us decided to do was to be proactive with the message of mental health and wellness and suicide prevention. Uh, Many of us have multiple years of experience in working not only in higher education, but also in community mental health as well. And we realize fully that messaging is crucial to individuals. And then in 2015, when House Bill 28 became law in the state of Ohio, I'm going to actually share that screen. I hope um, if it's going to let me, it may not. So it is not allowing me to share my screen, folks. So Chris or Madison, this is where my call out comes into you. So, House Bill 28 was brought forth by Representative Marlena Nielski on slide 2 there. Yeah, and what we see, what the law was requiring was that institutions of of higher education, I should say, I'm sorry, develop and implement a policy to advise students and staff on suicide prevention programs. And at Tri-C, and you can see what some of the specific parameters were. At Tri-C, we had these things in place because, quite frankly, we realized that we were handing out way too many hard copies of referral sources. One hard copy might have been for 211, another hard copy might have been for homeless shelters, and and so on and so forth. So we wanted to condense them all into one website, and that's where Help Us Here was born. And from that point forward, the website has grown immeasurably to include all forms of media as well as a mobile app. And if we can get to slide 11, I believe it was. Um, there we go, perfect. You can see that one of the things that we have implemented throughout all of our guides, not just our student resource guide, but our employee guides as well, are QR codes. Um, we recognize that technology is not going to stop for those old dinosaurs, such as myself. We have our younger folks who have taken a very active role as part of our peer influencer group, which we'll talk about shortly. And then on the next slide, you can see how some of these things have been implemented on our webpage. You can see that we have access to not only campus resources in the event of an emergency, but also emergency resources for the county and national resources to include 988. And we also work very closely with statewide resources, especially the Ohio Suicide Prevention Foundation, who does do QPR trainings at Tri-C twice per semester and are typically attended by no less than 35 to 40 students and faculty who want to learn more about how to question, persuade, and refer individuals who may be in crisis or feeling suicidal. And then Madison or Chris, if we could go to the next slide, and to give you some examples of what we have done, you will see that we've also developed a mobile app. This mobile app has recently been refreshed and updated um, in response to a $360,000 grant that was given to us by the Ohio Department of Higher Education. And you can also see more of those QR codes that are available. And we would encourage folks to take a look at the mobile app. We don't get anything for recommending it, just for the record and in all transparency. Uh, However, what we do get from this is satisfaction in realizing that folks can maybe have a template to build upon in their own respective institutions. In light of all the changes at the state and federal level regarding mental health and mental health treatment, this is something that we feel is extraordinarily cost effective. This mobile app, our new version, was built by our IT department and by one of our cohorts in that group. And so we were able to excel quite well regarding what we were asked to include in the app. So our IT department was very open in the communication with us as far as the content. And you'll see, just to give you a visual there, we have some of those um, go to screens right on the front page of the mobile app. So 988 is available, 911. And what's really nifty is where you see the my friend's contact info and my support network, which are interrelated. It offers up to 5 phone numbers of friends and or contacts, so that if you feel that if an individual feels that they need to reach out to someone very quickly, you can just hit one of those buttons, and the computer, or the app I should say, will automatically generate a text message to the recipient asking if they have a minute to talk. And it's just a really nifty feature to have on there. And Madison, if we can go, I think that the resource guides are the next slides, or Madison or Chris, I'm sorry. So you can see again, a lot of these guides are also housed in the app. We have a student resource guide, which, as you can see, some of the examples, we have 24/7 helplines that are available. We also have local and national resources. And we include not only, again, issues related to mental health and wellness, but also to addiction services as well. And then on the next slide, it should be an employee resource guide. Oh, maybe not. It's the next one or not. So there is we have examples, I'm so sorry, of guides that we use for employees as well, not only to recognize their own struggles that they may be encountering and encouragement to reach out to our EAP, but also signs and symptoms that they may notice in students as well. So the Help Us Here site and mobile app has really morphed into an extraordinary resource that is available, as Carrie had stated, to anyone. It's not just local to Tri-C. Our goal is to actually impact more than just the Tri-C student, because we understand and recognize that suicidal behavior has such a broad impact on immediate circles as well as mental illness. And what we are trying to do is address any potential for ripple effects as well. So, with that, I'm going to go ahead and turn it over to Carrie.
Dave, I'm not sure I can add too much more to what you've already talked about. You've covered all of our amazing resources that they are on the public website. So I would encourage you to take a look. If your institution doesn't have anything like this, please feel free to use these models. And, Dave and his team were instrumental in really getting this app up and running. And I think it is a powerful tool for students. So again, reach out to Tri-C or Dave if you think your institution could benefit from including something like this. Much of the resources are going to be within the Northeast Ohio area, because obviously that's where we serve. But it doesn't mean that you couldn't create an app for yourself and your region to support your students and employees.
Yeah, and we would definitely make ourselves available to anyone that does have questions about some of the organic foundations of their app and growing it from that point forward. There are so many elements to the app that focus not just on suicide prevention or ways to help other people. It also links to a general information page that I like to call the cornucopia of knowledge. We have diagnostic information available to individuals who may have questions about what depression looks like or what anxiety looks like, what PTSD looks like, and other forms of trauma. In addition, we also have a relaxation page, and I say that with a smile because I find myself referring to it multiple times a week with the stress levels that we endure. Um, but there are ways that are included on this app to relax your mind, your body. We offer tips to relax in nature. And, when I was affiliated with Akron University and taught human relations and death and dying classes, these were all elements that we also shared with the classes even back then as well. We just didn't have this clearinghouse of resources that were available to students. And so if anyone does have any questions or would like to start something, please, by all means, feel free. We recognize this is about our students. This is about our professionals who serve students as well. We realize that burnout can happen on both ends of that candle. And so we want to ensure that all bases are met, for lack of a better description. So with that, Allie, I'm not sure if you wanted to add.
No, I think you did such a great job, Dave, and I'm sure some of the pieces that you shared, I'd love to talk further about.
Well, I want to say thank you to all of you for sharing. And um, Dave, we certainly even appreciate the refresher on House Bill 28, and the Help Us Here app definitely seems like an awesome instrument, a tool for not just students but also faculty and staff to take advantage of. And so, actually, even talking about suicide prevention is a perfect segue to the next question. But I do see that we have a few questions that have presented in the chat. One request, Dave, if you don't mind sharing your contact information, perhaps even a link to the Help Us Here page. I think that would be wonderful. And there is a question that presented in terms of, and Crystal, I don't know if you want to unmute and share yourself, but I'll be happy to also carry it forward.
I can unmute. I appreciate the information. I love the app. I wrote it down, so just could spread the word. So thank you for that. Just wondering, there is a lot going on, so just being a student is stressful. And now there are many things coming down that's adding to their stress. And so just, you know, just here and now, right? This is real, this is in front of us. And just wondering if there's anything that you've done to really support those students that maybe are scared, they're scared about what might happen to them, their families, their community members, while also continuing to show up every day and do what they need to do to be successful.
Yeah, I
So
think
go ahead, Allie.
Yeah, thanks, Dave. I was going to say, for our campus, I think it's first recognizing our referral methods that we have so that when we know we have students who are in distress, our community knows how to connect them to our support mechanisms. So whether that's our care team, which would be more crisis intervention, or the team that I oversee, which would be our Help a Zip team, which is early alert and intervention for more mild distress matters. I think it's the conversation amongst colleagues and pulling together colleagues on your campus to have ongoing conversations about some of these issues that are evolving and recognizing that we have students who might feel, Crystal, I think you used the term correctly, targeted and very concerned, right? Carrie talked to us a minute ago about belonging, and that is so important for our students to feel safe and comfortable on our campuses, whether that's a physical campus or our the online community as well, being part of that. So I think it's knowing what resources are available, making sure we're putting those in front of all students, but also being very strategic in how we're sharing those with students. I think, Dave, one thing I love to see about the app that you shared was social support, right? And social networks. And so we do a lot of work talking to our students about who's in your circle, who are the folks that you can lean on. We hope that we're part of that circle, right? But we know that there's a lot of things that happen outside of campus, and that happens, and even things perhaps that you don't want to necessarily come to the student support office with, right? So who are the folks that you can really lean in on, and reminding students of who those people are? I think for us, the last piece I'll share is, also looking at our surrounding community. Our local community is full of resources. Again, I'm in the Akron area. And so particularly for our students who might be our international students, most recently, we've really tried to make sure that our students know what support networks also exist outside of the institution in our community that can be an extension of support for them, and for any students who might be navigating any sort of uncertainty. I think that's often our approach, is to look inward, make sure we know what resources are available, make sure our campus community knows how do we support students, make sure our students recognize their support networks, and then we look to our larger community to say what else is around us that can be a good resource and support for any student. Thank you, Crystal. This is a wonderful question, very timely.
To echo that, one of the things that we've also had to do at Tri-C recently was offer uh, some presentation and training at the executive level on de-escalation techniques, so that should our campus be visited by individuals who may have questions for some of our students in their current status, one of the things that we have encouraged a lot of our executives to consider is, again, how we approach that situation, and to be mindful of our own body language and anxiety levels to help with mitigating any type of further action, or to extinguish any type of escalation in behaviors that may transpire. So th- that's and sorry, Allie, but I can't stop thinking about Luigi's Pizza now in Akron. So I'm so sorry. If you've not been there, it's an awesome place. So sorry.
I think the only thing that add is a level of transparency that needs to exist at the college. College leadership and the executives are in statewide meetings. They have access to information, and ensuring that gets out to those various resource areas. So like your counseling center at Cuyahoga Community College, we're fortunate to have a Hispanic council, a Black American council, a Lambda council that really offers a higher level of student support. So ensuring that those staff members have the information, because what students are often looking for are answers, reassurances. And when the staff say, I don't know, that's where that increased level of anxiety comes in. So ensuring that there is transparency going back and forth, that the students have access to information, staff have access to information, but also that campus and college executives are listening to the boots on the ground feedback about what type of information would help to alleviate some of those anxieties and fears at the campus. So.
Thank you so much. And we have another question that's come in from Christy. Christy, if you want to unmute, you can, but if not, I'm again happy to share it forward. Go ahead, Christy.
Yeah, absolutely. I was wondering what interventions colleges are using in postvention response to support students with coping after a peer's suicide, and then also with preventing suicide contagion. Thank you.
So Tri-C, go ahead, Carrie. Thank you.
I think Dave and I were probably going to say the same thing. Actually, for the postvention, we are actually just launching a new initiative here at the college. We have our first meeting tomorrow with our counseling, some of our executive leadership, student affairs professionals, around what postvention will look like. From a personal level, I feel that our counselors know what to do, but it's the rest of the campus that doesn't know how to respond. So how do we put that into a more formative document, manual, resources that allows everyone else to be able to respond with the same coordinated and intentional and meaningful response? I'm sure many campuses could be an area of focus for a lot of us. We're so focused on the prevention that the postvention may not be the area that we invest our resources and our time into. So I will say that it's an area as Tri-C that we're working to continue to develop, leaning on the counseling team at our institution has been huge. But there are other factors that we need to consider with that postvention, from the contact with the family, the administrative aspects of their enrollment, then communicating with faculty and the community as a whole. So how do we do that in consultation with our faculty counselors to ensure that the families and the campus community as a whole feel supported by the institution, is an area where we will continue to work on.
That's excellent. Dave, did you want to add anything to that?
Carrie was spot on. She said almost what I was going to say verbatim. So thanks, Carrie.
Allie, go ahead. I see you're unmuted.
Yeah, I will just add, again, I think looking and being aware of resources in your local community and how those can be part of your postvention plan is duly important, whether that's having formal MOUs or partnerships in place. We often don't want to have to plan for those things, as Carrie alluded, but unfortunately we need to be ready. And so having partnerships that are kind of like ready to go, that if there is a situation, you have added support. I think many of us can attest that our counseling offices are wonderful. But in those moments in particular, it's important that we have as many resources to wrap our arms around our community. And that community is not only the family, Carrie, as you have mentioned, thank you, but it's also all of the students who might also be connected, student organizations in the classrooms, the faculty, the staff, if they were a student employee, right? There's so many different folks who could be exposed to trauma. And so how and in what ways can we make sure we have adequate and timely resources to support them? So I think your local community is a big part of your postvention plan as well.
Yeah, no, that's excellent to share. And speaking of trainings and additional resources, Patricia, if you don't mind sharing your question with our panelists here. I'll actually go ahead and state in case she's having some difficulty here. But the question is, on rare occasions when we see more of a true aggressive behavior, is there a particular training you would recommend, and specifically for faculty? And Carrie, I know you spoke in terms of campus wellness and counseling staff may know, but what about for other faculty? What
Well,
might you recommend?
I also am the conduct administrator for the campus. So when you're talking about true aggressive behavior, even though there could be a mental illness related need for the student, it doesn't negate the fact that there could still also need to be a referral to student conduct. And that could help to actually facilitate a much needed referral for the student to some mental health related supports, whether internally or externally to the college. So I think using your college's student affairs office or student conduct office to be able to have those conversations is critical. And don't be afraid to make that referral. There are additional trainings that could be available, but sometimes they're kind of behind those closed doors of larger professional organization memberships. So like NABITA as a whole will have some type of training, but usually there are individuals at the institution who hold those memberships. It's not a broad institutional type. So working with individuals in student affairs and who oversee conduct, I think would be critical. And don't be afraid to use a conduct referral if it is concerns, if there really is a concern for the student welfare, your welfare, or the others in your classroom.
I would echo what Carrie just shared. Additionally, Patricia, it's important that we understand aggression can take many different forms, and we would have to determine, the type of aggression that that individual is exhibiting. If it's verbal, which obviously can be just as bad as physical in some instances. If it's being disruptive to other students or to the classroom in general, or quite frankly, during office hours, if there are certain elements of aggressiveness that make a person feel uncomfortable. So being trained in critical incident stress debriefing and stress management, there are some additional trainings that can be had by faculty and staff. But in our case at Tri-C, we definitely utilize the student behavior concerns system. So if a professor or staff do have and concerns about an individual's behaviors or sentiments in class, or quite honestly, based on some papers that they may submit. We have a lot of English professors who submit things to us who are very concerned about some of the conveyances of students. And so one of the things that we do is we do gather together as a bid team at each respective campus, and then also collectively several times per semester to look for ways that we can find viable and healthy solutions for everyone involved. And sometimes that may include off campus referrals. And quite frankly, sometimes that may include involvement of our police department as well.
I'll add to the conversation, recognizing that consultations are really important. So knowing who on your campus to go to, and making sure your faculty know, hopefully that there's an open door, that when they do have a situation in the classroom, they might not know which form to fill out or which, what goes where, but to know that, if it's your dean of students or if it's your AVP or if it's your ombuds, where can a faculty member go to say, I have a situation, what do I do next? Because I recognize that many of our campuses have a lot of complex systems and processes. And sometimes, especially as even an adjunct faculty member, you might not know all those things. Or as an online faculty member, not physically on that campus, you might not know where to send a student. So making sure that there's an open door and folks know who to go to. I think in terms of training, I would offer the Center for Conflict Management at the University of Akron offers a 13-hour conflict resolution and de-escalation training. We had about 40 members of the Division of Student Affairs and some folks from our Academic Affairs Office who did go through that training. We found it very helpful. And to your point, to dig a little bit deeper, right? Not just a basic 1-hour de-escalation, but truly a certificate in conflict resolution. So I think that that's a really good tool, a little bit more investment of time and resource, but certainly was very much so well appreciated.
While we're talking about just additional trainings, as you mentioned, Allie, mental health first aid, in addition to the QPR training, would be another amazing resource that can be available. For example, like our student affairs team from the various campuses attended a session with the Cleveland Clinic a couple of years ago. And so we were all certified through that process. So it is something you can do like through a division or an office to be able to gain that support.
All right. Thank you all for sharing those great trainings and resources. And I'm going to actually put this out to our audience as well. I know we have a number of folks who are really doing the work as well. And if you have a training or a resource that you would also like to share, I invite you to drop it into the chat and or unmute. But we'll move on to the next question. Again, those are some really, really amazing resources that you all have shared. And thank you too for those even practical examples or scenarios that you may encounter a student who's exhibiting aggressive behavior. And so we'll move on. And of course, our conversation at hand here today is stronger together, right? And so we know a strong campus community partnership not only builds trust, it enhances student learning and contributes really to that thriving local campus community environment. You all have shared some really amazing and creative ways that your campus and community partners are already collaborating to really address those unique mental health challenges on your campus. But of course, we know as we are in some challenging and really transitional times that funding and resources and those sort of things could be and are, limited and changing. What additional partnerships do you think would be particularly helpful to really share with our audience here today? Might there be some interdepartmental or other external campus or community organizations? And so I am going to put that question out to you all.
My first thought is, as oftentimes we're student affairs professionals through the counseling center, you kind of fall under that umbrella, that scope. So I would definitely say, how do we work with the academic affairs side of the house? So trying to build those partnerships, using early alert types of systems, looking at, Dave mentioned earlier about having faculty liaisons from various disciplines who can serve as like wellness ambassadors for the institution, for their students, for their own team members, as a site where we could have some internal collective community where we can all be brought together. And then I'd also bring in student life. I would definitely want to partner with the student clubs and organizations, because ultimately that's how you're going to reach the students to be able to spread that information as well.
Yeah, I think adding on to Carrie and Dave mentioned earlier, and Dave, I think you had a different term, but I would say certified peer educators. If you have a CPE program or looking into a certified peer educator network or an ambassador program of some sort, wellness ambassadors, as Carrie mentioned, I think are important. I think not forgetting our parents and our families. We consider them as part of our culture and community of care. And so how and in what ways are we educating our parents and our families about the resources that are on our campus, so that they too know when a student is stressed or bubbling, how and in what ways can they help to connect them and reinforce campus resources. I think for us, again, going back to community, looking at some formal partnerships and MOUs with local behavioral health organizations, that has proved beneficial for us for training as well as postvention and preventative education, marketing and outreach as well. And so how and in what ways can you look at that local community partners and welcome them onto your campus? We do a mental health resource fair, for example, and we will have about 10 to 15 different organizations that are represented from the community, in addition to all of the folks that they have come to know on our campus, from the Dean of Students office to the counseling center, to our School of Counseling, to our social work program. Even on our campuses, there's a lot of different majors and colleges and programs that are dedicated to behavioral health. So we welcome those experts into our conversations. Many of our faculty are practitioners themselves, like Dave shared in his introduction. And so we want them around the table, not only as faculty representatives, but because they also have that added expertise through their own, consultation and counseling services that they might be doing as well. So, and again, I would be remiss not to say human resources. They're a really important partner. We can't do our work unless we are healthy and able to do so. So making sure that we are also taking care of the core, being our faculty and our staff on campus, I think is really an important piece to the puzzle.
Thank you so much, Allie and Carrie. And Christy, thank you for the training mention that you've dropped in the chat. And of course, Patricia, NAMI Young Adult, of course, NAMI on Campus. I know many of you may have those chapters, as well as Active Minds and other chapters on your campus. And so again, as you think of resources, trainings, and groups, just feel free to share it with the group here today.
I had to chuckle because at Tri-C, we are in day 2 of our mental health and wellness fair. That does include a bunch of community resources and community providers. And it's been an extraordinary thing to be able to watch all of the interactions that our students have had. And we have multiple different activities in this. It's not just tabletops. Yesterday, we had a sound bath, and today I believe they're doing drumming, amongst other things. And there's Kahoot quizzes regarding steps that students can take toward wellness, and they receive, nifty little gifts and things along those lines. But it really is about participation and recognition. So, really great point, Allie.
Wonderful. Thank you all again so much. And as we come up on the last few minutes of our chat here today, I want to ask our final question, which is looking ahead, what are the key opportunities and priorities for improving mental health and suicide prevention on Ohio's campuses? And what suggestions do you have on navigating the evolving landscape of campus mental health to wrap us up today?
I'll be brief and just say, I think knowing our networks is really important. Conversations like this are very much so valuable. I think sometimes we can be siloed on our campuses, knowing that we're doing the work and we're really collaborative on our own campus, but we're all experiencing so many of the same things. So how can we make sure that we're finding time, space, and places to where we can have conversations like this, so that we can beg, borrow, steal, and modify things from our peer institutions and our partners and friends across campus to ultimately, we all have the same ultimate goal, and that's to support our students. That's supporting them, yes, while they're enrolled, but also just as holistic people, right? So how can we have conversations like this and continue to be partners amongst one another in the work that we're doing to support mental health?
Thanks, Sally. Add into that, shifting that cultural shift within the campus of how do you move from it's a counseling related issue to it's a campus community related issue. So I think that's the broader question that we need to continue to work through. But having groups like this who can continue to organize and advocate for the cause across the state is really critical. We need to be flexible because we need to be able to adapt and shift as we've seen over the last few months as the landscape has changed here in our country. Like we need to be able to shift with that as well. The continued collaboration and then just leading with compassion. We're all human. We're all going through this experience together. So opportunities to perhaps share personal experiences so that students can relate in some way to the challenges and struggles that they're facing and know that there can be other options that they can choose.
To echo those wonderful sentiments, one of the examples that we like to use in our department is to ask individuals to envision a very calm pond and then a boulder being dropped in that pond and that ripple impact that it would have into the shores. We want students to be those ripples, and we strongly encourage them to extend way beyond our campus family and campus community into their own respective communities. Irrespective again of their cultural background, they can still make a positive impact. And that's one of the things that we really emphasize. With respect to collaboration, I can say for sure that the Help Is Here team has been available not only throughout the state, but throughout the region as well. And we had the opportunity to take part in the Midwest Suicide Prevention Summit held last fall. And it was amazing that people from as far away as Green Bay are asking about how they can implement similar programs. As I had stated previously, this is about how we can help others. And we are very sincere and we walk that walk on the daily basis. And that includes with our colleagues across colleges and universities, not just in Ohio, but in other states as well. If they have questions about how they can build this, we want to help them and we want to show them ways that we can do this. And it really, if we stop and pause and consider this, we are we are building a foundation not just for today, but for something that can impact that student for the rest of their lives. And we are so passionate about that. And it can't be emphasized enough that the longevity of this is greatly dependent on the participant. So with that, I will turn it back over to Jessica and to Madison.
Well, certainly thank you, Carrie, Allie, and Dave for not only sharing some really great programming and resources that you have available at your respective campuses, but also how we can continue to look at ways for partnerships and collaborations with our colleagues and partners across the state and external to Ohio. We have just a few minutes remaining, and I do want to invite any final comments or thoughts from the audience. This has been great. As you mentioned, Allie and Dave and Carrie, an opportunity for us to get together. This is a new format for our webinar today, but we certainly also believe that it's valuable and very beneficial to glean. And I'm going to borrow what you said, Allie. I think you said borrow still, and if I have that right. But I really like that we're not reinventing the wheel. But if someone has like the Help Us Here app, how might that be beneficial and useful for others who are doing the work? So I want to invite any comments or thoughts from our audience today. Thank you all for taking the time out of your schedules to join us today. All right. Well, we are very quiet. With that being said, I'm gonna say that again. We thank you for your time. For those who are looking to participate in upcoming campus safety and mental health programming, we certainly invite you to join us on May 15th in Dublin, Ohio. And we also invite you to join our Department of Psychiatry and PEGS Foundation for the upcoming Dr. Fred and Penny Freeze lecture on May 6th from 12 to 1 p.m. Thank you again so much, everyone, for your time. We also invite you to join us next month. Please be on the lookout for details as students will share with us, nothing about us without us. And again, more details to come for that. Thank you again, everyone. Have a wonderful afternoon.